Hello, everybody. How are you today? Let's see if this is working. So I had a little issue getting Facebook and Zoom to coordinate. So I couldn't do this directly onto the event. So I hope you guys are able to get on and watch. Hello. I am talking about why going to PT twice a week for 4 weeks may not be getting you anywhere. This is a common comment I hear from my clients. And they say, well, I've already tried PT. PT doesn't work for me. Physical therapy doesn't work for me. And maybe. I invite you to think of these things that I'm going to talk about today to see if physical therapy really didn't work for your condition, or if maybe you need to try different physical therapy. Okay, so that's what I'm going to talk about today. I am aiming, here is one of my goals for January, is to do a live every weekday for the month of January. So in order to do that, I have been keeping a log of questions that those of you here in the Facebook group ask me, and the, questions you ask in comments, questions you ask me in private message, also questions I get in email, questions from my current clients, things that come up a lot. However, I invite you to ask me questions because I'd love to answer your questions of, whatever it is that you have about your joint pain. If I can answer it in a video like this that everybody can benefit from it, I would love to do that. I can't answer everything on the video. Sometimes it involves, a specific one person only, like it's your specific problem, and that involves a phone call. And I do offer free clarity calls, so it's to clarify what you need, what your next best steps are to get the pain relief that you want. So I do offer those. So if you ask me a question and I think that it's suited for a live video like this, I will do that. If you ask a question and I think it's better suited for that clarity call, I will invite you to do that as well. So why physical therapy twice a week for 4 weeks might not be getting you anywhere. So why can I talk about this? So many of you who don't know me, we have many new faces in this room. My name is Dr. Allie. I am a physical therapist. I am a personal trainer, and I'm a nutrition coach. I became a physical therapist, got licensed in 2012. So it's going on 10 years now. And I worked in a typical outpatient physical therapy clinic up until 2018, where I realized that the way people need help and the way people want help, I could not give it to them in the traditional physical therapy clinic. The system is broken, and I was only able to give my clients, my patients, about 5-8 minutes of my time. And I just felt like I was seeing more patients that weren't getting better in the time frame that they should have. They, thank goodness, weren't getting worse, but they certainly weren't getting better. That years before, I was able to see that they were getting better. So anyway, long story short, I made a change. I created my own business. I started doing physical therapy services in the area that I live in. I live in Las Vegas. I was going home to home and doing outpatient physical therapy in the convenience of people's own homes. And now I have just transitioned that to online services, helping people get better so that they can move with less pain in more of a personal training and nutrition coaching way. Some people do need formal physical therapy for an injury, to rehab an injury. And so if I think that they need that instead, I help them that way. And I'm just finding that the people that I'm working with, it ends up being different. So anyway, that's the long version of why I'm qualified to be able to talk about why going to physical therapy twice a week for 4 weeks might not be working for you. So the first reason has two parts to it. So the first reason that physical therapy didn't work for you or may not be working for you currently is you're going to the wrong physical therapist, the wrong physical therapy clinic. So this one has two parts. So physical therapy has many different specialties. So I specialize in orthopedics, bones, joints, muscles, and then even more specifically, people who have degenerative joints, so arthritis and other types of joint problems that happen as we get older and create pain and problems from that. So an orthopedic physical therapist will work with bones, joints, muscles, tendons, ligament problems. You can also further subspecialize in that and do sports physical therapy. So somebody who works with athletes, whether it be high school athletes, college athletes. So you could be going to an orthopedic physical therapist, but they might specialize in sports injuries. So if you're 50 or 60 years old, you didn't tear your ACL from the basketball game, and you're looking around the clinic and you see, oh, there's a 15-year-old soccer player who tore her ACL a couple months ago, and there's a college basketball star who tore his ACL or hurt his ankle. If you're finding that you might not be in the right physical therapy place or not sure if you are, look around. Do the other people that are there look like you? Are they relatively close to your age? Are they coming for similar things? Now, your physical therapist can't tell you what everybody's coming for, but you can ask the person themselves, like, hey, what did you do? Oh, did you have a knee replacement? Or, oh, hey, are you trying to prevent a knee replacement? Another thing that you could be doing is you could be seeing a neurological physical therapist. So somebody who works with stroke, multiple sclerosis, traumatic brain injuries, Parkinson's disease. So those types of treatments, exercises, modalities, those are going to be different than for somebody who has arthritis, joint pain, muscle pain. You know, you might be doing similar exercises, but the thought process behind it and the whole program is just going to be different. So that's one way that you might be going to the wrong physical therapist. That's one way that the 2 times a week for 4 weeks might not be getting you anywhere. Because if you're seeing somebody who doesn't help your condition, well, you're probably not going to see results right away. You know, same thing going to a physician, right? You're not going to go to, what's an example? You're not going to ask a cardiologist about your ankle sprain, right? You're going to ask your orthopedist about your ankle sprain. And you're not going to ask your orthopedist about your, the heart stent that you need to have placed, because they don't specialize in those things. So they're not going to be quite as equipped to answer those questions. So checking to see if you're going to the right physical therapist. Another way that the physical therapist might be a wrong fit for you is you don't mesh well with that physical therapist, right? We don't get along with everybody. I don't like everybody. Not everybody likes me, and that's okay. But if you don't mesh well with the person who's trying to guide you to healing, then you're probably not going to get anywhere. Like if your goals don't match up, let's say that you just need to be able to get up and down from the floor so that you can pick up an item that fell, or you can clean underneath and like grab something that's fallen underneath the cabinet or the dresser or something like that, right? But your physical therapist is like, oh no, we're going to get you walking 7 miles a day. We're going to get you running a marathon. There's the mismatch there, and it's not going to work out. They're going to be having you do things that you don't think are appropriate. So you're not going to want to do the exercises or take the advice or things like that. So if there's a mismatch and you don't mesh well, your personalities clash, your goals clash, something like that, then you're not going to see the progress like you probably should. So those are two ways that going to the wrong physical therapist is hurting you, and why going twice a week for 4 weeks isn't going to get you very far. The next way that maybe the twice a week for 4 weeks isn't working for you is you don't have enough time with your physical therapist to ask questions. So this is one of the things that I ran into big time when I was in the clinic. I felt like a chicken with her head cut off. I felt like I was running around every which way, and I didn't know what was going to happen. I didn't know who was coming in that day. Many of you guys have heard my story about Clarence. That's a true story. If you have not heard the story about Clarence, let me know in the comments, and I'll tag you in the post about the time we lost Clarence in the clinic. And I had no idea that where he had gone. You know, I was seeing most of the physical therapists now because, spoiler alert, the physical therapist works for your insurance company to get the insurance company the best bang for their buck. So they have to see many patients a day. In the clinic I was at, I was regularly seeing 25 people in my workday. Some of my colleagues at the same clinic were seeing 40 in the workday. And that's an 8 to 10 hour workday. We kind of worked 4 10s or 5 8s, mishmash, stay late, come early. And when I realized that I wasn't recognizing people, I'd see names on my schedule and I'd think, oh, who's this person? That was put in wrong. That's marked as a follow-up, but really that person's here for an evaluation because I don't recognize their name. And then I find out they've been here for 12 visits. That wasn't good. So you might not be getting better because you just don't have enough time with the healthcare provider who's supposed to be guiding you along to your healing process. So another reason that physical therapy twice a week for 4 weeks might not be working for you is you're not doing anything else the rest of the week. You go to physical therapy twice a week. You do your exercises there. You get your ice and your stim there. And that's it. Then the other 5 days of the week, it's same old same, whatever you're doing at home. You're not doing any other exercises. You're not icing your knee at all. You're not taking care of it, whatever body part it is. I use a knee as an example because it's a common place that people have pain. And it doesn't work that way. The work needs to be done daily. And if your physical therapist can't give you something that's tolerable to be done daily, then you're seeing the wrong physical therapist. You should be able to do some movement every day. A little bit of discomfort might be expected depending on what you're working on, but it shouldn't put you down for the count for, another 2 days. You shouldn't be leaving physical therapy and saying, okay, well, now glad I only do physical therapy twice a week because I go Monday, Thursday, and I'm down for the count Tuesday, Wednesday, and then I'm back ramped up to go. My knee feels better. Now it's physical therapy again on Thursday, and then I'm down for the count Friday and Saturday. Sunday's a good day, Monday's a good day, but we're right back to it. That's too much. That's too much. You shouldn't be down for the count. You might be sore for a little bit of time, couple of minutes, couple of hours after the therapy, you go and ice your knee, you rest your knee, you heat your knee, whatever it is that works. That's your pain relief modality. That should alleviate the pain, but it shouldn't put you down for the count for the next 48 hours. So that's one way that doing 2 times a week for 4 weeks isn't helping you, isn't working for you because you're not doing anything else the rest of the week. And that leads me into the next thing of doing just twice a week for 4 weeks. And if you're only doing the exact same things every time, and maybe you need to because it's so painful, But the PT should be regressing the exercises if that's the case, where makes things easier, less painful on the body, less painful on the knee, whatever body part. Again, I keep saying knee just because that's a common one people have problems for. I could say the same thing about the back, but you're not progressing or regressing appropriately. Every couple of visits, what I liked to do when I was seeing people 2 to 3 times a week was check in every day and make sure things were feeling okay, but really looking at what we were doing. Are we doing ice? Are we doing e-stim? Are we doing heat? Are those things helping? Are they not helping? What exercises are we doing? What exercises could we be doing? What's too much? What's too little? And looking at the whole plan and adjusting accordingly. So that may be why 2 times a week for 4 weeks isn't working for you, because the progression or regression of things just isn't happening. There's no change there, right? And it doesn't have to be a big change. It could just be 1 or 2 little tweaks, but that could be why it's not working for you. And then going back to talking about putting you down for the count for 2 days after therapy, not addressing pain relief techniques could be why 2 times a week for 4 weeks is not working for you, because you need a pain relief technique. Yes, the exercises are great, but what do you do if it just hurts so much? Does ice work for you? Or maybe you can't tolerate ice. I don't do very well with ice. I hate the cold. Now the cold, the ice makes my hives worse. So for those of you who have been in my world since the beginning of November, I have chronic hives. So the ice would not be a good thing for me. That would make me break out in hives. But so maybe the ice doesn't work for you, or maybe it does work for you. Maybe you need to use more of it. Maybe you need to use it for a longer amount of time. Maybe heat, like a hot pack, works for you. Maybe the electrical stimulation, the e-stim, the TENS unit, maybe that works for you. Maybe a hot bath works for you. Maybe going to a massage therapist, working with them in conjunction with the physical therapy. But if you're not having the conversation to figure out what your pain relief technique is for you, you can do all of the exercise in the world, but if you can't control your pain, it's not going to do you any good, because you're still going to hurt. That's why that's the top thing I help my clients do first. Let's figure out how to get rid of your pain, or at least control it. I mean, we might not be able to get rid of it completely. A lot of people are in pain for a long time. Sometimes there are other things going on that we can't get it all the way down to 0, but let's control it and make it more manageable. Make it so that you have better days than most days. Okay, so not addressing pain relief techniques might be why your physical therapy 2 times a week for 4 weeks isn't working for you. And then finally, may not be working for you going to physical therapy twice a week for 4 weeks. And this is one of the reasons why I continued on learning the things that I've learned, is you're not able to address the inflammation that you have from all aspects. So many people have pain because they have chronic inflammation that's coursing throughout their whole body. Maybe it did start off in the knee, and that's when it was acute, under a month. After the first month of the pain, it moves on. It's no longer new. It's no longer acute. And then it can continue and go throughout the whole body. So now we have systemic inflammation. Well, cold pack on your knee isn't going to help your knee pain if the inflammation is not only in your knee. If your inflammation's throughout your whole body and we throw an ice pack on your knee, well, yeah, it's going to control the inflammation at your knee for the 20 minutes the ice pack's on. But then as soon as you take it off, the inflammation's just still circulating through your blood system, your lymphatic system. It's going to go right back to your knee, and your knee's still going to hurt. Right? So we can't we can't address the inflammation completely in the physical therapy clinic. How do I know that? Because the insurance doesn't pay for it by a physical therapist. They don't want physical therapists talking about dietary changes, because that's what you need to do to get the inflammation that's coursing through your whole body. You need to control it from the inside. And how do we control it from the inside? We control it from the inside by what we put in our body, how we eat, anti-inflammatory diets, not eating foods that create inflammation, like sugar, and for some people, gluten and dairy and other things. We can't talk about that in the physical therapy clinic because insurance doesn't pay for it. As a physical therapist in the state of Nevada, I can talk about nutrition. It's in my practice act. I'm allowed to talk about nutrition as long as I have studied it. I can't claim to be a dietitian. I never would, because I'm not a registered dietitian, but I am a nutrition coach. And I took a course to learn as much as I can in that capacity to be able to guide people into these foods are inflammatory. These foods are not inflammatory. These foods are anti-inflammatory. How much water to drink, how much, what kinds of supplements will help with inflammation. And other things. I focus on inflammation. So that's where I mainly looked at it. But we can't talk about that in the physical therapy clinic. So that's why maybe your 2 times a week for 4 weeks might not be working for you. And then finally, 2 times a week for 4 weeks is nothing. For somebody who's been dealing with pain for months, years, or decades, going to a month of physical therapy is a drop in the bucket. It is so small to what needs to be done. You haven't given it enough time for it to even work. So going through the whole list that I just talked about, maybe you check off all of those boxes and you are going to the correct physical therapist. They do work on the type of problem that you have. You do mesh well with your physical therapist. You do have time to ask questions and they give you adequate, appropriate answers. Maybe you are doing exercise throughout the rest of the week and controlling your pain the rest of the week. And maybe they are progressing or regressing the program appropriately. They are addressing the pain relief techniques. They are addressing the inflammation from the inside out. Maybe you just haven't given it enough time. So why do physicians write a prescription, a referral? I'm going to call it a referral because most states, physical therapists are autonomous practitioners. They do not need a referral to see somebody. The insurance requires a referral in order to pay for it. But if you wanted to pay out of pocket, you wouldn't have to have that referral. Legally, you wouldn't, most states. But maybe you just haven't given it enough time. And so doctors write a prescription 2 times a week for 4 weeks because that's when they're going to see you again, right? Don't they always say, okay, try therapy and come back in a month. Try these pills, come back in a month. Try walking on the treadmill 30 minutes a day and come back in a month. It's always come back in a month. That's why they write the referral for twice a week for 4 weeks, because you're going to see them again and they'll hopefully write you another referral. But really, it'll take about 3 months before you notice differences. 3 or 4 months. If you're really working on the whole thing, it might take longer. Yeah, so those are my reasons why I think twice a week for 4 weeks is not the best referral that doctors give for physical therapy. And there are lots of little check boxes to make sure that you're seeing the right person who could help you. And in the end, it might just come down to, if all of those check boxes, you've hit them all, maybe you just haven't given it enough time, because it does take 3 to 4 months, really, of consistent hard work. Okay, so that is all I have for today. I am aiming to go live every weekday, for the month of January. So please ask your questions if I think it will be appropriate to share the answer with everybody here in the group, I will. If I think it's more of a one-on-one conversation and it's more specific to and tailored to your specific needs, I invite you to talk to me about a clarity call, which is a free session on the phone to just see what are the next steps for you. Should you find a new physical therapist? Should you just go work with a personal trainer? Should you go find a registered dietitian? Do you need to just go find a new physician who can help coordinate different things? So those are your options, and I am happy to help wherever I can. And I look forward to speaking with everybody, and I will talk to you guys soon.